Good. Thank you for having me.
Thank you for being here today. Uh, your career journey is so, you have so many things that you've done. And I'm excited for people to really learn how to, I think, try things out in order to decide what they want to do later on, which is really what you've done. So thank you for agreeing to be on the show today.
Great. Thank you. It's been a remarkable journey with the support of family and friends, and I think
Alhamdulillah.
it's
Thank you. Can you tell us first, what was your, I think you didn't really want to get into, you didn't see yourself as a vascular surgeon. I don't think anyone knows what they're going to do in the future. But what was your first little hint at, this is what I should do?
so. As you mentioned, I've sort of tried a bunch of different things. I've gone through different career paths, and I think one of my first things I wanted to even go into surgery was, I saw uh, this is as something that I didn't know much about, so I wanted to learn more about it. And the more I learned about it, the more I liked it, and I wanted to pursue it. So I pursued surgery in the same fashion, vascular surgery, and it's this uh, vascular surgery happens to be one of those fields which sometimes treats the sickest of the sick patients in a hospital. Um, and I think being able to be there to offer some assistance to those patients is what really sort of attracted me to this field.
Yeah. So let's go back to the beginning. What did you initially think that you were going to be when you were in undergrad or high school?
Sure. Yeah. So when I first started, I went to Hicksville High School in Long Island. Afterwards, I went to Stony Brook, and at Stony Brook, I had no, I had some idea of what I wanted to do, but I couldn't imagine at all that medicine was any part of that
Mhm.
idea at all. In our culture, it's like one of those things that you should be in medicine, you should be a doctor or lawyer, but it's just one of those things that's not something I really thought. So I sort of went in with a bright idea, and I happened to be good at mathematics and
Mhm.
sciences, so I pursued information systems, and that's something I was very good at. And eventually I got an internship with Citigroup, and then I
Mhm.
worked there for about a year and a half, for a brief period, and then so that was my initial path of sort of getting into college and figuring out where to go from there.
Yeah.
Throughout this entire time, I had internships all throughout, in different aspects of in my undergraduate studies. So I kind of just did all that. Um, uh, Even to even go to get into medicine, that's even after finishing my undergraduate, that's still not something I wanted to do.
That's
I
so
wanted to pursue,
interesting.
yeah, I wanted to pursue law school. My father, we came to America when I was 11. My father was a high court justice in Pakistan.
Hmm.
Um, so that's something, that's something that was very attractive to me, and I wanted to see if I should pursue law school or, go into try to go into law. I actually took my LSATs. I did fairly well, but I didn't. I decided against it at the last second, and I sort of, walked away from it. Um,
Why
but
didn't you end up pursuing it?
it's one of those things. I had a very good job at Citigroup,
Mhm.
and I thought about why would I continue this field when I have a very good job, and I'm not sure what else I would add. Maybe, I'm sure there's different fields and all, but that's not something I approached except for
Yeah.
being a judge. I didn't really know much about it, so I didn't get into it. But that's something that was one of those things that that I've always questioned. But
Yeah.
but that's I still had the opportunity to pursue other things, so I pursued. So let that go. I worked at Citigroup, and then there's a lot of family things going on at that time.
Yeah.
And I saw patients' access to care was limited, and it was difficult. So I wanted to find out more about this. Attracted me to public health, and I went to pursue master public health. Um,
So after getting
uh,
your master's in public health, you already had an undergraduate in,
right,
what was it?
information systems.
Okay. And then
So
from there, you worked at Citigroup, and then you went into, just so everyone can know your career path.
yeah,
um,
so I did information systems. I worked at Citigroup.
uh-huh.
I went to Master of Public Health after I told Citigroup that I'm going to leave, and I
Yeah.
started my public health program. And then from there, I went through a different phase of where I was at the lines of actually, working on pandemics and,
Mhm.
this COVID-19, which I hope everyone's is very safe and healthy from still,
Inshallah.
and we're not, hopefully, and then we can help the people who are affected. But this is something we sort of worked on back in, 2004. I want to say
Mhm.
2003, 2004, and
Working on setting up a
uh,
system in case there is a
yeah,
pandemic. Mhm.
exactly. So back then, there was the anthrax attacks that were going on. There was a flu pandemic. There was, as far as the SARS was going
Yeah.
on. So all these things were sort of there, and the flu has always been one of those things that what's the worst thing that can happen to mankind is, is
Mhm.
if it's something is very, very virulent that can, which can which can be very which can kill people easily. It can be transmissible from one patient to one person to another, which can be
At the
very
time, not
bound, and
knowing
all
that
these
it
things.
could actually happen.
Well, it's happened in the history many times before,
Mhm.
but so this was something that was predicted to happen, but we didn't know when it was going to happen. But so we wanted
This
to
soon.
prepare
Mhm.
the public health sector for it.
So,
So we put out,
do you
yeah,
think
sorry.
that it was truly like proper preparation at the time, seeing everything that came out at the
No, so
right now?
so so in public health,
Mhm.
is from my limited experience in public health. And there's a lot of people in our community might be more experts, but public health, I think it's one of those things that if it's prepared,
Mhm.
if you prepare for it, you won't see it. You won't
Okay,
see the disasters that can happen if there's public health preparedness. But if there's a lack of it, then you'll see the disasters.
that makes sense.
And that's what this is, because there's
Mhm.
lack of preparedness. And I think that's where we kind of that's the shortfall. There's no funding from the government
Mhm.
to these things until there's a crisis.
Yeah.
Um, that's something I learned during my public health program and when I was working at the one of the think tanks.
Mhm.
Um, that Congress and the federal government really act when
An
there's
actual
an
crisis
imminent
at
danger,
hand.
or when
Mhm.
there's something, or there's actually a crisis ahead. Yes,
Mhm.
that's the only time there's actually anything that happens. And so there was no preparedness funding, and all these preparedness fundings were cut, and they've been cut traditionally every year. Every so often. Um, until the next big thing hits, like the anthrax attack, if they were to happen, or the sarin gas release that happened back in Tokyo. So all these things, when all these things happen, that's when you have something that people worry about, a pandemic or a mass casualty
Mhm.
event, and you prepare for those things. But until then, nothing goes on.
Yeah.
So I digress. But that's what I wanted to do, and that's what I really like doing. And then I kind of backed away from it. I wanted to. Then over there, I decided, I thought some of my voices was sort of being drowned out by a lot of the physicians that were there. So
Mhm.
that's, it's kind of forced me to look into a career in medicine, and so that's the route I chose.
So, being on that table, on the side of the public health spectrum, let's say, and seeing the physicians, did they have a louder voice in affecting what gets looked into and given priority?
So there's many voices
Uh-huh.
in a whenever there's a different table. I think one of the things we should take away from this and any meetings that we have in our community is uh, we need to have a voice. Doesn't matter if it's loud, but we need to have a voice at every table.
Hmm.
So we need to have people in different specialties and different things, different fields of work, that so you can have a voice at every table. So if you have somebody needs to be in politics, somebody needs to be a plumber, somebody needs to have everything. So just
Hmm.
in case, so we know who to turn to. We know that there's a voice who's looking out for our benefits. And I think in the public health sector, you did have the public health experts, but you also had physicians, and sometimes the physicians, their words would be a little bit louder. And I think it just happened to be that was the case.
Hmm.
It's not, maybe not the norm, but that happened to me. And when I saw it, and I kind of backed away from it.
Yeah.
Um, but that's one of my experiences. Um,
And then that inspired you to say, you know what,
yeah,
I
and I
want my
wanted to
voice to
learn
be
more.
louder. Hmm.
So yeah, so plus on top of it, I wanted to see what these diseases were that we've read about. I
Yeah.
want to learn more about them, and see how I can treat these people who had them. So public health is more of, you treat the entire population. So you look at, so for example, if you have smoking, you cut smoking, you're going to treat so many millions of people, right?
Hmm.
If you have smoking cessation programs, whereas a physician would literally go from each person and each patient, and treat each patient individually. So it's
Yeah.
it's a different aspect of looking at the similar thing, where you have health being looked at from a broader perspective of the entire community's
Policy.
health,
Mm-hmm.
and then you're looking at single patients. So I
Mm-hmm.
think it was a different perspective, and I wanted to sort of gain that perspective as well.
So
So that's
how old were you when you got into med school at the time?
how old was I?
Mm-hmm.
Got to med school in 2000. Was probably 20. I was 25.
Oh,
I was
you're very
25.
young. A lot of experiences at a very young age.
Uh, I was fortunate that I had a family who would, who was supportive, and and I think I wanted to pursue more, and I had brothers and sisters and aunts and parents and everyone and uncles and aunts and everyone who was supportive in all of these things. And I think that's the common thing. If people prohibit you and they sort of stifle you, they can lead you into one direction or another. But I think good thing is I didn't have all that, and I was able to pursue different things throughout my throughout my education.
Mm-hmm. Okay, so take us through your med school years. What was that like? How did you
Med school is
apply?
it was a wonderful time.
Mm-hmm.
Any schooling you go through while you're there, med school, be it undergraduate, public health, be it residency, during it, it's probably the most torture-filled time that you have. But when you look back at it, it's probably the best time you've had,
Mm-hmm.
right? I mean, uh,
I've actually heard that a lot.
yeah, I mean, so going through it, it was tough. You were there studying nonstop, many birthdays, weddings, family weddings, family deaths, family, mudlisses, everything. I've missed all these things, but you have to at some point figure out that if you have to pursue this education, you have to balance, see what's important at that time, and you have to have things in perspective. And if you can unfortunately, in a lot of this medical field, you will miss birthdays and
Mm-hmm.
weddings and celebrations that everybody else may be able to attend, but you're not. But that's okay. That's the life. Sometimes, that's just how it is. Even in other specialties, people miss all these events. So it's not really just medicine, but it
Yeah.
just happens to be that this is what we know of. But that's okay.
Just
It was
because of
very
the
educational. I learned a
how
lot.
demanding it is, as
Right,
a
right,
field. Yeah.
right.
So you applied like everyone else to med school. You got in. What school did you go to? And
So,
um,
I was a non-traditional candidate. Usually, people
really?
apply to schooling right out of college or towards their third year of undergraduate, so they
Mm-hmm.
know, or fourth year of undergraduate, so they know where they're going to go to take all the MCATs and everything. I applied much later, so I was sort of a non-traditional student. I had decent MCAT scores, but I eventually my choices were I go LECOM. I
Okay.
went to LECOM. I got into an osteopathic school in Erie, Pennsylvania, and that's where I went.
Mm-hmm.
And it's probably the greatest experience I've had. So it was, everybody can make their experiences. So whatever you have, you just try to make the best of it, and that's what I did. It actually led me to a lot more things to continue the things I wanted to pursue. It allowed me the opportunity to
Mm-hmm.
a lot more things I wanted to do while I was there. So it was a wonderful thing.
And then going into your rotations, what was that like for you as someone who likes to try everything and learn about everything?
Oh, it was amazing. I got to try everything.
Mm-hmm.
So in rotations, you have to try different fields. You try medicine, pediatrics, try every single specialty. Some you like more than others, but it was still it was wonderful. Every 6 to 12 weeks, or you'd be in a different specialty, learning different aspects of medicine, looking at a similar patient, but now you're looking at this patient from the OB perspective instead of looking at
Mm-hmm.
from the internal medicine perspective or even the pediatrics perspective. You're looking at different things. So it was very interesting. It's just uh, for me, it's something who wants to who liked everything. I think it was a great experience.
And what made you gravitate towards vascular or the vascular surgery field?
So I completed. So during so at the end, I had again, it goes back to your scores and everything. So if you're limited,
Mm-hmm.
so everything goes back to how well you did. So if you did really well,
In
then
schools?
all the specialties open up to you,
Okay.
right? If you're sometimes either you're not very lucky that you didn't get the chance to rotate at a specific place. So that happens in med school, but it also, if you didn't do well, it can limit your options. So the number one thing is just study. So everyone studies, but you just have to do well, and that helped open up all the options. So I was fortunate enough to have most of these options opened up, and I gravitated to I liked everything. So I liked anesthesia, I liked emergency medicine, which sort of was a jack of all trades, and I like surgery. um, I applied to all three of them. I went to a bunch of interviews for emergency and anesthesia, and I went to interview for surgery. And I just felt when I was talking to the interviewer for surgery that that's what I liked. And that's, when you can tell that when you're saying something, you really mean it. And that's what helped me decide really that, even though I like all these different things, me talking to this person about what I want to do is the real deal. And that's what sort of made me choose surgery.
That's so telling because it's like you didn't realize that this is what you wanted to do until you started talking about it to someone else.
Yes.
And I think your interest just shows. And people also play off of your passion. So maybe some piece of advice for people out there is to talk about what you want to do or thinking of doing in order to see if you truly like it when you're just speaking about it.
Yeah, I think one of the best things people can do, even for writing essays, this is one of the advice I got. Actually, I think I have a feeling maybe like 5-6 years ago, 10 years ago, Google used to do this, where for you to figure out how to solve a problem, you really just get like a teddy bear or something inanimate object, and you try to teach it what your problem is and how you can solve it. And if you can talk to something, it could be a person who would get back to you, but even just talking it out loud can help you solve these problems.
Yeah.
And I think, it's I mean, that's helped me, just talking things out loud with people, thinking them through. I think
It
that
really
just helps a
helps
lot.
bring together that perspective
Right.
that you have. So can you tell us more about vascular surgery? What does it entail? What is it for those who are listening?
Sure. So, general surgery. I did general surgery. General surgery is everything except for orthopedic surgery, which is bones, and neurosurgery, which is the brain. Everything else is a specialty or subspecialty of general surgery. So within general surgery, you have plastic surgery, you have colorectal, you have critical care, you have minimally invasive. You have so many different specialties. One of them is vascular surgery. Vascular surgery it treats all the blood vessel disorders from the brain, so outside the brain to the toes, except for the heart. So which means any major blood vessel diseases, so atherosclerotic disease, so peripheral arterial disease, DVTs, vein disease, varicose veins, people who need dialysis, which means when their kidneys aren't working because they're shut down. All of these things, they are anything that has to do with any blood vessel outside of the heart and the brain is treated by vascular surgeons. And that's very appealing because that's, again, opens up the ability for me to do everything. So vascular surgeons are able to offer open and endovascular options, and so you have different tool sets that you can offer to the patient and treat them appropriately. So vascular surgery. So to sum it up, so vascular surgery deals with everything, all the blood vessels. Number one, it deals with stroke patients to prevent them from having strokes. It treats by treating carotid artery disease. Patients who are smokers, we offer them medication to try to help them quit their smoking. That's sort of called vascular medicine, where you help them quit smoking, optimize the cardiovascular system, make sure blood pressure and medication are all set, which is in coordination with their primary care doctors. Treat their dialysis needs, treat their blood clots, treat leg cramps. So patients walk a block and they say they have cramps in their legs. That could be claudication, which means arteries not getting enough blood supply to the leg. So we treat those wounds, any ulcers you have, treat those. So there's a lot of things that we do. But the most common thing that most patients see me for is probably varicose veins. This is, at this point, at some point it becomes a vanity thing. So patients have varicose veins, they want to see it, they want to get them treated, fine. We treat those also.
Okay.
So we treat everything.
And what advice do you have for people to keep their arteries from getting clogged, to stay in that healthy shape so that they don't have to see you? Sorry, but
No, of course. So they right. So the number one thing is prevention. That's for public health.
Mhm.
Is right. Prevent everything. One of the biggest achievements of public health is smoking cessation.
Yeah.
So the less people smoke, the less likely the arteries are to get clogged. The arteries, if something is clogged, it means all of them are can't have the opportunity. So the one that goes to the brain, that's called the carotid artery. If it gets a narrowing, or atherosclerotic disease, that can cause a stroke. To prevent stroke, stop smoking.
Mhm.
Okay. Same thing with a heart attack. Prevent a heart attack, stop smoking. Prevent arteries in the legs from getting anything, stop smoking. Even preventing blood clots, there is correlation with blood clots because of heavy smoking, stop smoking. So number one thing is, in our culture, unfortunately, it's very prevalent, including the young people.
Yeah.
Sometimes they think it's okay. I don't, it's
And now
it's
there's
never,
different trends. What types of smoking should people
just
stop?
don't smoke anything. There's no reason to smoke anything. Right? I mean,
Vaping.
there's no vaping is probably the worst thing, right? There's been
Yeah.
a lot of injuries from vaping. So just don't smoke anything.
Mhm.
That's just
Don't
as
smoke.
a public service announcement. Don't
Yes,
just don't
please
do it.
don't.
Don't smoke hookah. Don't smoke tobacco. Don't smoke anything.
Mhm.
It's never worth it, right?
Mhm.
Number two is, after smoking, is treat their higher blood pressures. So as patients age, they have high blood pressure, or they have inherent disorders which have them do that, and so treat those. So make sure their medications are controlling all those things. Their diabetes is under control. So all
Mhm.
those things have to be under control to prevent patients from having to see me. Um, Usually, seeing a vascular surgeon, besides the varicose veins and dialysis needs, is sort of uh, the 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 later stages of disease progression.
Mhm.
So if patients were to see me for leg cramps because they can't walk a block now, is because now the arteries are so hardened and stiffened from plaque
That it's
buildup.
actually enabling them to do
It's
something.
it's yeah. So now you're
Disabling
seeing
them to do
symptoms
it,
of it.
sorry. Mhm.
So now you're seeing symptoms of it, or they're having stroke-like symptoms.
Yeah.
So now they're having symptoms of it. So it's a little late. I mean, I can treat it. I can figure. Usually most of the times you can fix these problems, but it's just to prevent it. Preventing is always better.
Yeah. So now the big, I think, star of the show, what we said in your little intro at the beginning. How do you market yourself as a medical professional?
So, I have been. So I completed my fellowship about 3 years ago. Since then, I've sort of gone up the ladders. I was most recently, until just about 2 weeks ago, I was a director of the Vascular lab at Mount Sinai South Nassau on Oceanside.
Mhm.
Um, I there was and I want to go up more. There's one of those things where I have published papers and I presented, and I want to continue in academics, and I want to continue doing all these things. I want to have the opportunity to go up more, and so I had to explore other options at that point. So I left. I left that. I'm currently at uh, at New York City Health and Hospital Services at Harlem Hospital. I just started this about 2 weeks ago. I'm also in
Mhm.
private practice in Lynbrook. Um, so I'm learning about how to market yourself, right? The number one
Mhm.
thing in all of this that I've found is you have to be good. So you have to have good outcomes. Um, for you to be good, you have to know what you're doing. Um, you have to have patients that
Mhm.
would like to come back to you. Or so basically, you have to be good at talking to people, I presume, and you have to be somewhat respectful, and you have to be very respectful. Um, Similar to all the teachings in Islam, you have to be very respectful of anyone you're meeting at all times.
Mhm.
And you have to listen to their concerns, and then you have to offer them solutions that we can offer them. And if you do all those things appropriately, that's number one. Um, and that's the crucified. Once you have that, then you have the other medical specialists that can help you send you more patients. But But in this day and age, there's a lot of marketing online, right? So everything gets done online.
Mm-hmm.
So there's Twitter, there's Instagram, there is a wealth of sites like WebMD, Health Grades, Vitals. Just Google. There's all these sites, so you have to sort of start flooding them at some point with your name. But
In
those
order to do
advertisements
that,
are only as good as your outcomes.
yeah,
So if you have bad outcomes, sorry, what were you saying?
I was saying in order to do that, you have to have also a good, I think, base to back yourself up on. So the papers that you
Right, exactly.
publish.
So you can,
Hmm.
of course. So you have to, you can flood all those things, but and you can have a big marketing campaign. The problem with that marketing campaign is the first person that comes to you, and they have a bad outcome, or people think that you don't know what you're doing, they'll
Hmm.
back away,
You lose
right?
your
And then
credibility.
so all that thing is gone. Right. So most important thing is how what what your perception is and how you are and how you're looked at.
Hmm.
So you have to know what you're doing. You have to be good at this. Um, I mean, I'm just starting out, and like I said, I've all these, you know, I've published, and I've presented, and I'm getting better at these things. Um, and but the next thing is now I start marketing, and I think that's all it is.
Hmm. And we have, I think, just a minute until the show ends, but we might go over just by 5 minutes. But uh, how hard is it to publish that first paper, and how do you find that opportunity to do so? What was your experience?
Sure. So we have a small community, right? So we have a Shia
Mhm.
community in New York. Uh, Between amongst the different communities and different sects of just Islam, and all the different religions that are out there, and all the different cultures that are out there.
Mhm.
What we have to do is get opportunity within ourselves,
Mhm.
right? So we have to get the opportunity. We have to give each other the opportunity to be involved. I was fortunate enough that I got the opportunity, not from in their community, but just from my residency where I was at, where I
Mhm.
was, where I was able to learn more about diseases, and I showed interest. And hey, there's a problem. One of my first papers was on dialysis, right? So patients were not getting their fistulas matured, or dialysis was not functioning well. So I looked into it, and I asked my attending, I was like, hey, what's the problem? He said, well, why don't you write about it? So that was my
Mhm.
first thing of getting a book chapter and thing out. I wrote on how to improve these things. And for me to do that, I had to research. But I
Mhm.
had the opportunity because I spoke to my attending, and I spoke to them. So we have to speak up. We have to ask the right questions. But within our community, we should be able to offer each other everything.
Mhm.
We have all the different, not just medicine. We have lawyers. We have everyone. And I think we should, as long as people know that we're all able to help. And I think for the students and the younger students, and um, whoever's interested, it could be older, anyone who's interested,
Yeah.
they can reach out to all of us, and we should be able to support them in any way.
And inshallah, people after this show can reach out to you and others who have been on the show to ask for advice if they ever need it. Um,
Yeah, of course, of course. I think that's the number
and
one thing.
that's the perks of doing the show as well.
Yeah, sure.
Um, so thank you so much. What is your final piece of advice before we come to the end of our show?
Um, Final piece of advice. I mean, it's just don't be afraid to take chances and try to do if don't go into thinking if this is for high school students. I think just take the opportunity to learn everything's out in the world. I might upset a lot of parents. Don't definitely look at medicine as the only one thing. There's hundreds of different things. Look at something, look at the broad perspective. You'll be a better person just by looking at everything else, and seeing what's out there. Maybe something has to be more appealing uh, to you, and sort of, you know, go find the right thing that's out there for you.
Mhm. Thank you so much, Dr. Rizvi. Thank you for your time and for sharing your experiences with us.
Thank you for having me.
Before we completely end our show, we would like to actually let you guys know that we do have something coming up for Umoja in terms of what Dr. Rizvi was just talking about, being able to reach out to professionals within our Shia community and learn more from them. We have a professional directory coming up soon, so we will give you more information on this in the future shows, but there's just a little sneak peek into that. Thank you so much, Dr. Rizvi, once again.
Thank you.
You were just listening to the uMentor Talk Show. If you missed this or future shows, you can always hear the replay on the uMentor website under prior talk shows. And while you're there, you can also subscribe to our iTunes or SoundCloud podcast so you never miss another show. And did you know that we've switched over to YouTube Live? Please tune in every week on YouTube Live to hear all of our future shows and some exclusive announcements. If you have any questions for our current speaker or prior speakers, please email us at mentor@umojaaoutreach.org and we will get feedback from our speaker. Be sure to tune in next week on Saturday at 3 p.m. to hear from our next guests. Thank you for listening to our show today on YouTube Live.